Hello everyone. Am I audible and visible to you? Okay. So myself, Dr.Shital Ghataliya, your faculty for physiology. Welcome on the platform of Unacademy. I did MD Physiology from MP Shah Medical College and I'm educating MBBS and MD students. I have teaching experience of more than 17 years and I am one of the experienced faculty for integrated curriculum teaching. Now Unacademy came up with All India mock test. You can attend the test on 26th of February at 9 a.m. Enroll for the test now and test your preparation journey. NEET PG notes are available. Comprehensive notes are available for the next, which will help you for the effective revision. So stay tuned with Unacademy. You can crack NEET PG with Combat on 19th of February. Okay. So let us go through some subscription details of Unacademy. With Plus subscription, you can have access to both live as well as recorded classes. You can learn from the topmost educators of India. You can compete in live tests and quizzes. You can study on the device of your own choice. You can have access to the question bank having more than 25,000 questions in it. With Iconic subscription, you can have access to the best from two of the best. Unacademy and Prep Ladder. With Unacademy, various resources like well-structured live batches, recorded classes, competitive live tests and quizzes and many more are available. Unacademy and Prep Ladder. With the Prep Ladder, clinical and integrated essential video lectures from Dream Team, rapid revision and snapshot and many more are available. Both are unique in its own way. Whatever is best suitable for you, that you can choose. These are toppers of FMG 2021. Congratulations to all the toppers from Unacademy. As I told you, there are series, educator curated test series, study with me YouTube test series and many more. Check with the time and date and different subjects for the tests. Special class feature are there. Now Unacademy came up with the special class feature. Now the classes will be highly interactive. There will be also a poll for the learner. You can raise a hand and interact with your educator. You will never miss a class because Unacademy will send you regular notifications. You can even have a lecture notes. You can download it and you can even have access to the recorded sessions. You can attend the classes from any time, anywhere. So there are different batches now. NEET PG 2022 all educator revision batch duration is 3 months. Target NEET next 2023 subject wise batch duration is 1 year. Focus FMG 2022 comprehensive batch duration is 9 months. Focus FMG 2022 comprehensive batch duration 4 months. So this is all about the different subscriptions of Unacademy available on the app. Let us go through today's topic, that is image-based learning. Image-based learning of blood. See, if you remember the image, I believe that when you remember image, it will help you to retain the content in a very easy way. Okay, so this is the image showing the functions of blood. Okay, so if you remember the entire system of the body, then you can remember these functions. So you just have to enlist all these systems: respiratory system, nutritive system means digestive system, excretory system, homeostatic mechanisms, regulation of body temperature and protective functions. So if you remember this, here you can write down immune system. So if you just remember these all systems, simply you can elaborate the content and you will be able to write down the different functions of the blood. Like respiratory system. Okay, जैसे कि blood का एक function है respiratory system से related, that is carriage of gases. Okay, it carries oxygen from lungs to the tissues and carrying CO2 from tissues to the lungs. right? So that is important respiratory function. Another one is a nutritive function, means when blood passes through GI tract, okay, whatever food you are consuming, it will take it absorb these nutritive substances, and it will transport it to the different tissues which can utilize those nutritive substances, or if it is not needed, then it can be stored. Okay, so that is important function. Then excretory function, when blood passes through excretory system, okay, that is kidneys. Okay, when blood passes through kidneys, then it will filter the waste products. Okay, different waste products, end metabolic waste products. When blood passes through the different tissues, end metabolic waste products are collected, and when it passes through the kidney, these metabolic waste products will be given, okay, and that will be excreted out of the body, right? Another one, the sum of the waste products is excreted in the form of feces, right? That is digestive waste products, right? Then homeostatic mechanism, maintaining the and stable constant and stable internal environment of the body. It is in terms of maintaining pH, electrolyte balance, maintaining body temperature, and many more. Okay, so maintaining the homeostasis of the body. Then regulation of the body temperature, right? Blood is having high specific heat and high conductivity. Okay, so whenever the body, when the person, like let's take an example, if the person get exposed to the cold environment, okay, then it blood from the peripheral, because of the peripheral vasoconstriction, blood will be diverted to the interior of the body and helps to conserve the heat. Okay, or when the person get exposed to the hot environment, in that case peripheral vasodilatation will occur, right? And it will help to dissipate the heat out of the body. Then immune function, protective function, right? There are different blood cells like lymphocytes, neutrophils, monocytes, macrophages. They all carry important immune functions. Okay, so these all this way you can write down, if it is asked in a short note, as a short note, that write down different functions of the blood, or if it is asked in viva, okay, that says enumerate the functions of blood, this way you can enlist the functions of the blood. Now this is the structure of hemoglobin. Okay, this is the structure of hemoglobin. See the composition, see the word itself says, right, hemoglobin means it is something which is formed of heme and globin, right? Heme and globin. Now heme is iron containing, it is iron containing porphyrin, right? So this is the structure. The globin is made up of a polypeptide chain, right? It is made up of a polypeptide chain. So different amino acids are there for it. See, the iron is present in Fe2 plus state. Okay. Iron in the heme is in the Fe2 plus state. This can only reversibly bind with oxygen. Okay, it can bind with reversibly with oxygen. Okay, in heme, iron and protoporphyrin 9 is there. Okay, iron containing protoporphyrin 9. Okay, it consists of porphyrin nucleus. Okay, porphyrin nucleus and iron. Okay, porphyrin nucleus consists of 4 pyrrole ring. It consists of 4 pyrrole rings. Okay, iron in the heme is present in Fe2 plus state. Okay, and it is attached to the nitrogen atom of each other. See this one, nitrogen atom. Okay, attached with the nitrogen atom of each pyrrole ring. Okay, so this is the structure of hemoglobin. Heme plus globin. Heme is Okay, so this way we can divide it, right? Hemoglobin, it is heme and globin. Globin is polypeptide chain, right? There are 4 polypeptide chains, and heme is iron containing protoporphyrin 9. Right, there are 4 pyrrole rings. Fe ion is present in Fe2 plus state, and it is attached with the nitrogen atom of each pyrrole ring. Okay, there are 4 pyrrole rings, right? So this way you can remember the hemoglobin. Now if we see the globin part, globin chain in adult, it is 2 alpha and 2 beta. Okay, alpha chain contains 141 amino acids, and beta chain containing 146 amino acids. Okay, alpha chain contains 141 amino acids and beta chain contains 146 amino acids. So there are 4 units of heme in one molecule of HB. Okay, there are 4 heme units. Because there are 4 polypeptide chain, right? So there are 4 ion. 4 ion are present. 4 ion atoms are there. It can bind. These 4 ion atoms can bind with 8 atoms of oxygen. This is very, very important from MCQ point of view. 4 ion atoms are there. 1 ion atom can bind with 2 molecules of oxygen, or you can say O2. Okay, so it can reversibly bind Fe2 plus. If ion is present in Fe2 plus state, then one hemoglobin can bind with 8 atoms. It can bind with 8 atoms of oxygen. Okay, or you can say 4 molecules, 4O2 or O8. This way you can write it. Okay, now come to the this is the representation how synthesis of hemoglobin occurs. This way you can remember, right? As I told you that it is heme and globin, right? So now you know heme is iron containing prophylline, and globin is made up of a polypeptide chain. So if we look at the synthesis, what are the things which is needed for it? Okay, so you can say that it is a protein, right? Different minerals and vitamins. These things are needed, right? Why protein is needed? Protein is needed for the synthesis of the globin part. Okay, it is needed for the synthesis of globin part. Then different minerals like iron, copper, cobalt and calcium. Okay, iron is a part of heme, right? So it is present in Fe2 plus state, and it is needed as it is important part of heme, right? So it is needed for heme synthesis, right? Then copper is important for absorption. It is important for the absorption, mobilization and utilization of iron. Okay, it is, you can simply you can conclude that it is important for the iron, for iron presence in the body, you can say, because it is important for the absorption, mobilization and utilization of the iron. Then cobalt is important. It is needed for the manufacturing of vitamin B12 in GI tract. Okay, it is needed for the manufacturing of vitamin B12 in GI tract. And calcium is also needed for iron absorption. Okay, so this is about the different minerals: iron, copper, cobalt and calcium. These all minerals are needed. Copper, cobalt and calcium, though their concentration, their requirement amount of its need is very less, but it is needed, right? Then vitamins, different vitamins like vitamin C, vitamin B12, folic acid, these all are needed for the synthesis of nucleic acid. They are important for the synthesis of nucleic acid. So this is the tabular form which will help you to understand the synthesis of hemoglobin. So simply we can conclude it like this. Simply you can conclude it like this: heme plus globin, right? So for globin, protein is needed. For heme, minerals and vitamins. Okay, different minerals are iron, copper, cobalt and calcium. Vitamins are vitamin C, vitamin B12, right, and folic acid. These all are needed. They are needed for the synthesis of hemoglobin. See the structure of hemoglobin. If you see the structure, okay, see this is beta chain, alpha chain, iron is present in Fe2 plus state. Okay, Fe2 plus state is needed for the reversible binding with oxygen. Okay, otherwise it will not be able to bind reversibly with oxygen. Now let us see the structure of the RBC, red blood cell. See this one, RBC. In the RBC, in the center of the RBC, iron is hemoglobin is present, right? Hemoglobin molecule we discussed already. We discussed, right? Now see the other part of other structure, other part of the RBC. That is only, you can say here there is a hemoglobin, right? So hemoglobin, mature RBC contains hemoglobin. Okay, it is not having, there is no nucleus, there is no mitochondria, right? No endoplasmic reticulum, no ribosomes, nothing like a typical cell, except you can say hemoglobin, right? So this way you can remember there are 4 pyrrole rings. Okay, iron is present in Fe2 plus state and hemoglobin is present in the center of the RBC. Now what is the advantage of hemoglobin present in the center of the RBC? It is important for the quick exchange. Okay, quick and optimal exchange of gases will occur. Quick and optimal exchange of gases will occur as hemoglobin is situated in the center of the RBCs. Okay, now if we look at the structure of the RBC, see the structure carefully. Okay, 62.5% is water. Okay, 62.5% is water and 35% is hemoglobin. You can say 90% of the dry weight of the RBC is because of hemoglobin. Okay, 35% is hemoglobin. Now another one is 2.5%. In 2.5%, rest of the things are present. Now what is this? Different nutritive substances. Okay, different nutritive substances, enzymes, these all are present in rest of 2.5%. Means protein, glucose, lipids, different enzymes of glycolytic pathway. Okay, glycolytic pathway, they are also present in these 2.5%. Okay, because RBC is not having mitochondria. Okay, they can't generate ATP, right? So for energy, RBCs are dependent on glucose. This glucose will be transported by facilitated diffusion. Okay, it will be transported by facilitated diffusion. In the cells, there are enzymes of glycolytic pathway, right? So it will, this glucose will be metabolized and energy will be generated that will be utilized by red blood cells. Okay, so this way RBCs will work. Now come to the another important image, that is image of sickle cell anemia. Okay, where hemoglobin is present in the form of or you can say HBS. Now what is this sickle cell anemia? Hello Vishal. Facilitated diffusion. Okay, so see, very briefly I will tell you, diffusion is of two types. Simple diffusion. See, the word itself says, in physiology understanding the word is very very important. Okay, simple diffusion and facilitated diffusion. Simple diffusion is the simple word itself says, means it will go according to the gradient. Okay, it is a downhill movement, it will go according to the gradient. Okay, so it can be electrical gradient, mechanical gradient, pressure gradient, concentration gradient, anything, but gradient is there. Okay, facilitated diffusion means simply it will not cross the cell membrane, but it need presence or help, you can say help of something. Now what sort of help? Help of carrier protein. Okay, they simply need carrier protein. Let's take an example. This is the carrier protein. Okay, so and if this is the substance which needs to bind, then it will bind with the binding site on the carrier protein. This binding will cause conformational change in the carrier protein. Okay, and it will cause movement of the substance across the cell membrane. So it is not dependent on the energy, it doesn't need energy, but yes, it needs some sort of help is in form of a carrier protein. Okay, so when it will bind with the carrier protein which are present in the cell membrane. Conformational bind, after binding there will be change in the there will be conformational change in the carrier protein, and it will allow the substance to move across the cell membrane. Okay, so RBCs will use glucose by facilitated diffusion. Okay, now come to sickle cell anemia. Okay, sickle cell anemia, see the word itself says, okay, means a cell is sickle shaped. Okay, here the cell, which cell? Red blood cell, right? Red blood cell is sickle shaped. So it is inherited. This is very important. It is inherited condition. Okay, it is inherited condition. Here in each beta polypeptide chain of HBA, each beta polypeptide chain of HBA at sixth position, one glutamic acid is replaced by valine. Okay, inherited condition, in each beta polypeptide chain of HBA at sixth position, one glutamic acid is replaced by valine. This is important from MCQ point of view. Okay, now what will happen if there is a change, one change in the amino acid sequence, right? So when there is a change in the amino acid sequence, normal RBCs are biconcave in shape, right? They are biconcave disc-like structure, right? But here, when these RBCs which are containing, rather than HBA, now it is HBS, because amino acid sequence is changed, right? So now RBCs are not biconcave, but when RBCs get exposed to the lower oxygen tension, they become sickle shaped. See this one? Okay, now this is the one which is normal. Okay, normal red blood cells flowing through the blood vessels. Okay, so this is it is like they are capable to enfold, they are normal, right? So they are capable to enfold, they can easily pass through the smaller capillaries, so they don't get ruptured, okay, when they pass through the smaller capillaries. But here when the hemoglobin is not HBA and it is HBS, so here what will happen when it get exposed to the lower oxygen tension? Okay, when it get exposed to the lower oxygen tension, then it will cause precipitation of hemoglobin. Okay, hemoglobin inside will get precipitated. Once it gets precipitated, then it will cause the formation of the crystals, or you can say tactoids. Okay, these crystals, elongated crystals. Okay, so it will elongate, and from the normal shape now it becomes sickle shaped because they will elongate. Elongated crystals will be formed. Okay, so now these are sickle shaped, right? So when now it will pass through the smaller capillaries, it will get trapped, right? And they are more prone for lysis. Lysis means rupture, right? So it will easily rupture. That is why this condition is called as sickle cell anemia. Okay, this is called as sickle cell anemia. Okay, why the name given sickle cell anemia? Because here RBCs are sickle shaped. Because of the sickling of the RBCs, they are more prone to get lysed when it passes through the smaller capillaries. Because of the lysis, there will be decrease in the RBC count, total RBC count. Okay, so that decrease in the total RBC count, that is called as anemia, right? So this is called as a sickle cell anemia. Okay, so you can correlate it now, right? That whenever the hemoglobin HB rather than HbA, here it is HbS, it is inherited condition. When it get exposed to the lower oxygen tension, the hemoglobin inside the RBC will get precipitated. It will form elongated crystals. So it will elongate, and RBCs will become sickle shaped, right? Now when it passes through the capillaries, they are very easy to get trapped and they are easy prone for lysis. So causes decrease in the total RBC count, and this is called as sickle cell anemia. If you look at the features of sickle cell anemia, you will find important clinical feature. If we look, then there will be enlargement of spleen. Splenomegaly will be there. Megaly means enlargement. Okay, so spleen enlargement, splenomegaly will be there. Because of the trapping of the RBCs in the smaller vessels, it will cause the blockage of the vessels, so it can cause chest pain. Okay, it can cause pleuritic chest pain. If it goes to the cerebral circulation, then it will cause stroke. Okay, so these are certain important features. All the features of anemia will be there. So, okay, anemia means that the features are like, general features are fatigue, easy fatigability, then pallor, headache, okay, lack of concentration. These kind of features are there. Along with that, it will cause a splenomegaly because RBC get lysed in the RE system of the spleen. Okay, so yes, Sanjay, that is because of the RBCs will get lysed in the by the RE system, okay, reticuloendothelial system of the spleen, okay, or you can say monocyte macrophage system of the spleen. So the over functioning of these organ will be there. So it will cause enlargement of the spleen. Okay, apart from that, blocking of the vessels will also be there. Okay, so smaller vessels, nutrient vessels are very small, right? So it can cause chest pain, pleuritic chest pain. If it goes to the cerebral circulation, it will cause a stroke. Okay, so these are something common features with sickle cell anemia. Okay, now come to the important another image, that is phagocytosis. See, sickle cell anemia, phagocytosis, these all are important short notes. Okay, phagocytosis, see the word itself says, okay, phagocytosis means engulfment. Okay, engulfment of foreign particles. Okay, or you can say harmful substances or foreign particles. See, already in the image everything is given. First one, if you just remember the image, you will be able to write down everything. Okay, first is margination. Okay, first is margination. Okay, then second, diabetes. Diabetes. Okay, immigration and diapedesis, that is the second stage. Then immigration. Okay, immigration itself, word itself says like moving, right? Moving from one place to the another place. Okay, then chemotaxis. Okay, and this one, third stage, right? And opsonization. Okay, I will explain this everything in detail, and the rest, second half of the phagocytosis is in another slide. Okay, so let us understand these four stages first. See, margination. Word itself says getting marginated, right? So normally what will happen, RBCs are, see, when the blood flow, regular blood flow, central axis of the blood flow is occupied by the cellular elements of the blood, and periphery is by plasma. Okay, fluid part, right? So that is how normally blood is flowing through the blood vessel. Okay, centrally it is by the cellular component and periphery is by the fluid part, that is plasma. Okay, now whenever any tissue, okay, any tissue get injured, from this central stream, WBCs WBCs will migrate towards the peripheral site. Okay, so it will marginate along with the endothelial lining of the blood vessel wall. Okay, so that is marginating, means moving along with the endothelial cell lining. So that is margination. From center, now it has come on the side. Okay, because it want to move out of the blood vessel. Okay, so that is margination. Then second stage is immigration and diapedesis. Okay, pedesis, so it will move. Okay, so what it will do is it will form a podos, like pseudopod will be generated. Okay, foot like process. Okay, see this one, it will try to generate a pseudopod and it will try to move out of the blood vessel, right? So by this diapedesis and immigration is moving from one to the another place, means it is moving from the blood vessel to the tissue which is invaded, okay, by any antigenic process. Okay, so it will move from the blood vessel to the tissue. Now once it comes out, okay, in between these cellular junctions between the two endothelial cell, it will move. Okay, it will generate a pseudopod, it make a pseudopod and it will move out. Okay, now it came out, but now it don't know that where to go. So who will decide that where these migrated WBCs will go? So for that, there is a process called as chemotaxis, right? So chemotaxis means it will cause attraction, okay, that tissue which is involved by the antigen, okay, it will generate the chemical substances. It will generate the chemical substance which will guide and it will attract these migrated WBCs that this is the place you are supposed to come. Okay, so chemical substances will be released, okay, by inflamed tissue. Okay, or so this will cause, it will direct, okay, it वो उसको रास्ता बताता है, like, okay, that migrated neutrophil की भाई यहाँ आपको आना है. Okay, so this chemotaxis means it is a process where chemical substances are released from the tissue and it will attract the migrated WBCs towards it. Okay, so that is chemotaxis. Now next is opsonization. Opsonization, there are certain substances which act as an opsonine, like components of complement system. Okay, so what it will do, it like it will coat, it will coat the antigenic material or bacteria and make it tasty to be phagocytized. So it is like a buttering, right? वो butter polish करता है और वो it will make it tasty to be phagocytized by the phagocytic cell. Okay, so these are the four steps, right? First is margination, second immigration and diapedesis, immigration and diapedesis, then chemotaxis and opsonization. Now the next one, okay, after opsonization, the next stage is a stage of engulfment. Okay, this is the stage of engulfment. Then there is a stage of degranulation. See, the word itself says, right? Degranulation. Then the next stage is killing stage. Okay, killing stage. Okay, and last you can say residual bodies that will be thrown out by the process of exocytosis. Okay, now let us understand this first one. Engulfment. See, this is the antigenic component which needs to be phagocytized. So what it will do, and this is the phagocytic cell. This phagocytic cell can be anything. It can be neutrophil, it can be monocyte, okay, anyone, okay, any phagocytic cell. So whenever it comes in contact with the antigen, any antigenic substance, okay, what it will do is, this is the antigenic substance and this is the phagocytic cell. So it will throw the folds, it will try to enfold the antigenic component from all these sides. Okay, so what it will do, it will throw the folds, okay, around it. Then gradually move towards each other, this enfolding, okay, and finally it will fuse. Okay, finally this will fuse, it will come very near each other and finally it will fuse. Okay, when it will fuse, okay, it will take the antigenic component inside it. Okay, so that is the stage of engulfment, means enfolding around the antigenic component. Okay, gradually this enfolding will come near each other and finally it will fuse. Okay, once it will fuse, then it will form this phagocytic vesicle. Okay, let me draw it very clearly. Okay, it will throw a fold around it. Okay, and then it will form a phagocytic vesicle like this, and then it will pinched off into the cytoplasm. Okay, something like this. Okay, this is phagocytic vesicle. Now in the cytoplasm there are already lysosomes. Okay, lysosomes are the one which contains varieties of enzymes, right? So different enzymes are there in the lysosomes. Okay, and this is the phagocytic vesicle. Different digestive enzymes are there in the lysosomes. What will it will do? Lysosome will fuse with the phagocytic vesicle. Okay, they both get fused. Now they are fused, so called as phagolysosomes. Okay, because now they are fused, so called as a phagolysosome, also called as the phagosomes. Now the next stage is the degranulation, because what the word itself says, degranulation means these phagosomes, inside this phagosome, the one which is formed, lysosome will pour, it will pour its content, granular content, so called as a stage of degranulation. Okay, this is, it will cause release, it will pour its entire content in the vesicle, phagolysosome, which is formed. Okay, lysosomes are containing varieties of digestive enzymes, so it will digest these antigenic components, right? So that is the stage of killing stage. Okay, killing stage. Killing stage can be oxygen dependent or it can be oxygen independent. The one which is oxygen dependent, okay, when it is involved, at that time there will be sharp increase in the oxygen uptake and there will be generation of free radicals. Okay, superoxide ions will be generated and it will cause the destruction of the antigenic component. Okay, so now once the component is destroyed, it can be killing stage, can be oxygen dependent or it can be oxygen independent. Okay, so now once there is a killing of the antigenic component, the one which is remaining inside this vesicle, phagolysosome, these are called as residual bodies. Okay, residual bodies, they are non-harmful, right? So what it will do, it will come near the cell membrane again. Okay, then it will fuse with the cell membrane of the phagolysosome, which contains the residual bodies inside it. okay, that will fuse, cell membrane will fuse, and the substance will be thrown out of the cell by the process of exocytosis, right? So this is how the phagocytosis will occur. So now if we list, okay, there are 7 important stages, okay. The first one is margination, second immigration and diastasis, third chemotaxis, fourth opsonization, then fifth engulfment stage, then sixth is degranulation stage, then killing stage, and last is the removal of the residual bodies by the process of exocytosis. Okay, so this way you can simply, by remembering the image, if you just remember the image, you can write down everything. Okay, see the image. ओके अगर आप इमेज अच्छे से याद कर सकते हो तो आप हर एक चीज को अच्छे से लिख सकते हैं. सी द वर्ड image itself shows, okay, everything, okay, engulfment, degranulation, residual bodies, then removal of the residual bodies by the process of exocytosis, everything. Okay, you can write down everything simply by remembering the image. Okay, so today I covered very important three topics, you can say. Okay, RBC image based, okay, RBC hemoglobin. Okay, these all are the functions which are important from viva point of view. यो viva में पूछा जाता है. Okay, अगर आप hematology का viva देते हैं तो viva में पूछा जाता है कि write down the functions, say the functions of the blood. तो आप हर सिस्टम को याद कर लो बॉडी का, तो हर एक सिस्टम में सर्कुलेशन में क्या रोल प्ले करता है, तो वही आपको बोलना है, राइट? So that way you can write down respiratory function, excretory function, maintaining body temperature, homeostasis, protective function, nutritive function. ओके अगर इसको भी आप इजीली, अगर ये आप डायग्राम याद कर लेते हो तो आपको याद आ जाएगा, राइट? Fe2+ आयन चाहिए, रिवर्सिबली ऑक्सीजन के साथ यही बाइंड हो सकता है. सी देर आर 4 रिंग्स, ओके, सो देर आर 4 पायरल रिंग्स. सो आयन प्रोटोपोर्फायरिन 9 इज देयर इन द हीमोग्लोबिन. ओके, सिंपली अगर आप ये टेबल याद कर लेते हो, यू विल बी एबल टू राइट डाउन अबाउट द सिंथेसिस ऑफ हीमोग्लोबिन. और रेगुलेशन ऑल्सो इज वन ऑफ द सेम, राइट? जैसे कि ग्लोबिन, हीम है और ग्लोबिन है, तो ग्लोबिन के लिए प्रोटीन चाहिए और हीमोग्लोबिन के लिए मिनरल्स और विटामिन चाहिए. अब इंपॉर्टेंट मेजर क्या है? आयन. तो आयन इज इंपॉर्टेंट. ओके, अपार्ट फ्रॉम दैट ट्रेस में क्या चाहिए? कॉपर, कोबाल्ट और कैल्शियम. ओके, विटामिन में क्या चाहिए? विटामिन सी चाहिए. विदाउट विटामिन सी आयन एब्जॉर्प्शन विल बी अफेक्टेड, राइट? बिकॉज दैट्स व्हाई विटामिन सी डेफिशिएंसी causes anemia. Okay, vitamin B12 and folic acid are needed for the synthesis of the nucleic acid. Okay, so simply by remembering the image, RBC, hemoglobin, सब कुछ आप लिख सकते हो, right? Everything is, see the diagram itself is enough to remember everything. Right? Sickle cell anemia, simply by remembering the image you can write down everything. ये normal है जिसमें HbA है, और ये है जिसमें HbS, sickling हो गया है, right? So why sickling occurs? Because it is not HbA and it is HbS, right? At beta polypeptide chain, one glutamic acid is replaced by valine at 6th position. Okay, so because of the in beta chain, at the 6th position, one glutamic acid is replaced by valine, so HbS is formed. So when it is exposed to the lower oxygen tension, it will change the shape into sickle shaped, because the hemoglobin will get precipitated and it will form crystals, long crystals. So it will elongate the RBCs and they are sickle shaped now. So when it passes through the smaller capillaries, they get lysed. So it will cause decrease in the RBC count, decrease in the total RBC count. So it will cause anemia, right? And then the features of anemia, and the because of the trapping of the cells in the RBCs, which affects the circulation, that you are supposed to write down. कि भाई उसमें chest pain हो सकता है, उससे stroke हो सकता है. ओके, बिकॉज इस तरह के आरबीसीज होते हैं सर्कुलेशन में, स्प्लीन को ज्यादा फंक्शन करना है, इट नीड्स टू रिमूव इट फ्रॉम द सर्कुलेशन ऑल द टाइम, सो देयर इज अ स्प्लीनोमेगाली, एनलार्जमेंट ऑफ स्प्लीन अकर्स, राइट? तो इस तरह से आप लिख सकते हो. एंड दिस इज ऑल अबाउट द डिफरेंट स्टेप्स ऑफ द फेगोसाइटोसिस, जो हमने ऑलरेडी डिस्कस कर लिया है. right? Now if you have any question, आप पूछ सकते हैं. If you want me to repeat anything. You understood everything, all of you? Okay, so I hope all of you understood everything, and stay tuned with Unacademy Future Doctors. You're always welcome. Stay tuned with the study. Okay. On Academy Future Doctors Pay, I am taking physiology classes. You can join my live classes, and you can join me on special classes on app also. आप app पे भी join कर सकते हैं special classes के लिए. Just hit the bell icon of the Unacademy Future Doctors channel. You will get notifications, okay, of the live classes. So study hard, study with us, study with me. Thank you so much. Subscribe on Academy Future Doctors channel and help us to reach to more and more number of students. Thank you so much.